welcome. This is part of the Basic Income Conversation seminar series. So this is an ongoing program that we've been doing for a couple of years now that is really focused on the research or the technical side of basic income and intersecting issues. We have lots of wonderful past events on our YouTube channel. Samuel will share the link to our YouTube channel so you can have a little nosy through those. And this event will, is being recorded and will be added up there too in the future, so you can watch it back if you fancy. But tonight we are looking at basic income and our mental health, and I'm joined by Sophie and Jen, who will introduce themselves in a moment. This Monday was so-called Blue Monday, so you might have been bombarded with marketing messages telling you to take a bit more time to look after yourself, or corporate kind of well-being incentives to improve mental health from companies that are pushing their employees to the brink of mental health crises themselves. So that Blue Monday, potentially a bit of a nonsense term or idea, but what is not nonsense is the real impacts that financial security has on our mental health and on our lives more broadly, but through that effect it has on our mental health. And that is what we're here to discuss this evening. I do want to say at the top of this event, obviously mental health is a deeply personal topic. Mental illness is something that affects us all, directly, indirectly, and the link between mental health and financial security is particularly frayed at the moment because of how thinly spread our finances are and how inadequate a lot of the support is. So we're here to talk about trends and ideas and basic income and how that might affect mental health if it's a policy that we manage to win, and how we might go about doing that. Inevitably, the human side of this will come in, and yeah, just want to make sure that people know that this is something that if you are being directly affected by it, or as we all are, when we're talking about the trends and the research, we're not dehumanizing that no one is a statistic or a data point. You're a human being being let down by a broken system, and that's exactly why we're talking about these big ideas and basic income. So yeah, be mindful of how this might be a difficult topic to, and I'm sorry that it's a Zoom webinar and we can't be more personal in the effects that might have on people. Feel free to drop out. Like I say, the full video will be on YouTube if you want to catch up in due course. I'm going to hand over to Sophie and ask her to introduce herself, and then move on to Jen so we know who we'll be speaking to tonight.
Thanks, Cleo, and many thanks for inviting me to talk to you all today. I'm Sophie. I'm a Wellcome Trust Research Fellow based at the University of Liverpool, where I work on a few projects that look at the mental health effects of changes to the benefit system, of which universal credit is one, and I'll speak to two analyses within different projects that I'm involved in. I just wanted to flag up to the audience, and I hope you don't mind, that I've just come off of mat leave, so with my second child my brain is not working at full capacity, and at some point during this I will be breastfeeding, but I'm hoping you won't see. Apologies in advance if it causes a disruption.
No apologies needed. Jen?
No, none needed at all. Hi, I'm Jen. I'm a community clinical psychologist as well. Thank you for inviting us here to speak with you. I'm speaking from a group called Psychologists for Social Change. We're a network of applied psychologists and anybody interested in psychology that wants to apply that thinking to people's broader circumstances and contexts. So thinking about how that impacts us. I'm from the Welsh network, so I'm from Psychologists for Social Change Cymru, and I'm one of the co-chairs there. In my day job, I work for a charity called Platform. We also do similar kind of things, looking at mental health and social justice.
Thank you. So yeah, lots of various experience on the panel alone, and I'm certain much more in the folks that are joining us as attendees tonight. I wanted to mention a piece of work that we did a while back on mental health and the idea of basic income and how it might impact mental health. This is called the Peace of Mind Project. So this project had 4 components. The first was looking at the context, the existing evidence on basic income and mental health and how they interact through pilots that have been done in the past and all around the world. And then there was a process of discussion with people with lived and professional experience of mental health. So looking at the dynamic of money, mental health, and how basic income might shift that. And all through those discussions, what came out was the idea that how am I supposed to look after my mental health when all I can worry about is money, and how am I supposed to find an income and a secure source of income when my mental health is completely on top of me and not something that I can manage. there was also some fantastic facilitators who did some work to sort of condense people's lived experience in stories and into, so we have a couple of wonderful films on our YouTube channel with people talking about their experiences and sort of a creative approach to talking about how, you know, how they felt or what they learned from those conversations about basic income. And then we followed that up with an action which was writing to the ministers responsible for mental health in England, Wales and Scotland, which unfortunately didn't go very far. Nadine Dorries was the minister in England at that point. But Samuel, again, will share a link in the chat to the Peace of Mind project, so you can have a little look through that, and I would encourage you to. It's yeah, one of the projects that we've done that I'm most proud of. And without me going on much more, I'm going to hand over to Sophie to tell us more about her work and get started from there.
Oh, thank you. Okay, so we know that experience of poverty is harmful to health. A child born in Kensington and Liverpool, which is where I live and work, can expect to live 10 fewer years than a child born in Kensington in London. And this rises to 20 years when we think about life lived in good health. So experiences of poverty is stressful. It's stressful on the mind and on our body. Some previous work looking at the physical and mental health effects of poverty using nationally representative cohorts of UK children showed that 1 in 5 children were in persistent poverty from birth up until the age of 14. And it was any exposure of poverty which was associated with worse physical and mental health in adolescence at that age 14. And moreover, there was a clear, what we call a dose-response relationship between poverty exposure and risk of mental health problems at age 14. So the more poverty you experience, the worse your potential mental health effects can be. So we have consistent evidence, that is one of many evidences that show us the harms of poverty on health and mental health. And we know that these harms from childhood can track forward into adulthood. And it puts a greater strain not only on the individual, but can add pressures on our services as well, such as use of healthcare, social care and the welfare system. Now, there have been many changes to the welfare system, as I'm sure many of you already know, which is a system that was introduced to support people facing adversity. Over the years, we've seen multiple changes, and the biggest potentially has been the introduction of universal credit, which was introduced in 2013 as this kind of flagship reform to replace 6 legacy benefits. Its primary aim was kind of simple. It wanted to simplify a complex social security system that is hard to navigate and is costly, and move people into work, placing less burden on the state, with an assumption that work was the best route out of poverty and into financial security. It replaces elements of job seeking allowance, housing benefit, working tax credit, child tax credit, employment support allowance and income support. And it's important to note the changes made to its implementation. So this is a fully digitalized service, whereas previously you could go into a job centre and do pen to paper. Payments made directly to claimants, whereas previously housing benefits, for example, could go direct to landlords. It's paid monthly in arrears with an assumption that people are paid monthly, whereas previously there are some benefits that can be paid 2 weekly, 4 weekly, things like that. It has increased conditionality, so conditions placed on people that are in the work stream to meet work commitments. And ultimately, it's a reduced payment. It's not as much money. There is also this minimum of 5-week wait to get your first payment. And on average, evidence shows that it's actually around 12 weeks until you get any money. Early evidence suggested from GP practitioners, charities, and qualitative work that the introduction was associated with a rapid increase in use of sanctions, so stopping people's money, as well as food bank usage, increases in debt, mental health difficulties, and consultations with general practitioners. Now, back in 2020, which seems like yesterday to me, but could also seem like 5 years ago to many people, I published some work on this where I focused on the mental health impact of the introduction of universal credit for unemployed people specifically as part of my Wellcome Trust fellowship. And this was the first nationally representative quantitative study on mental health impacts of universal credit. It was published in the Lancet Public Health, which I think has been put in the chat. So this is pre-pandemic and pre-cost of living crisis, but the findings are still relevant today. We used an experimental design with two main questions. Does mental health change for unemployed working age people eligible for universal credit when it was introduced in their area? And two, has the introduction of universal credit moved people into employment, as this was a key target of the policy? Now, we used a nationally representative data source of over 50,000 people using the Understanding Society's data. It's high quality longitudinal data, which is designed to help understand the long-term effects of social and economic change, as well as policy impacts of the UK population. And we linked this rich data with the Department of Works and Pension data on universal credit claims. We measured mental health within the data source using the General Health Questionnaire and the 12-item short form health survey, using validated cutoffs for mental distress, which can reach clinical thresholds to identify population levels of mental distress, and recent and active depression in the general population. Now, we use this longitudinal method, so using data that spanned back from 2009 all the way to 2018. And this has enabled us to compare the change in mental health for unemployed people with a change in mental health in a comparison sample that wouldn't be affected by the policy. So before and after universal credit was introduced. And we looked at that across England, Wales, and Scotland. Essentially, what we found was that 7 in 100 unemployed people experienced worse mental health as a result of universal credit's implementation. 7 in 100 might seem small, but when you put that back out onto a population level, the estimate of the introduction of universal credit, we estimated as 64,000 unemployed people experiencing psychological distress between 2013 and 2018 as a result of universal credit. And of those, 21,000 were likely to be clinical levels of depression. So adding to an already high demand service in order to support people with their mental distress. And that number one aim of universal credit, to move people into employment, we did look at that, and we found no evidence that universal credit was moving people from unemployment into employment. So we have this large scale study that has provided some evidence that universal credit's implementation has a detrimental effect on mental health. But some may ask why. What is it about universal credit? And I believe this stems back to how universal credit has been implemented. Now, I have early preliminary findings from colleagues, which I'll mention, Suzanne Moffat, Mandy Cheetham, Marcia Gibson and Steph Morris, who are leading a longitudinal qualitative analysis that is looking at this exact thing, looking at what is it about universal credit and how is universal credit affecting people. And they've so far conducted in-depth interviews with 60 people with direct experience. And they found multiple mechanisms within the universal credit system that are affecting mental health. So the first is that it's simply not enough. It's not enough money. And the second is that there's elements about universal credit system, the financial insecurity, the debt and uncertainty. They found which is worsening existing mental health and creating mental distress. It's creating this daily stress of trying to survive. They found that sanctions and threat of sanctions, delays to health, the working capability assessment were negatively impacting health. So it's this constant worry every day of being financially insecure. When is the money going to be taken away from me? They found automated messages in the digital system was creating anxiety and stress, and that there were huge inconsistencies in implementation. They also found key vulnerable groups, so people with health conditions, especially those living alone, people with health conditions that were transitioning from ESA, and one of the key vulnerable groups was lone parents, who are often transitioning from tax credits onto universal credit through a sense of worthlessness and guilt and this feeling of being trapped in the system. So in addition, they've sort of found the unemployment, in addition, when you're feeling this sense of stress and financial insecurity and food insecurity as a result of moving on to universal credit, they found that you're not in the right frame of mind to be applying for jobs and being successful in obtaining jobs, and particularly one that will bring you above the poverty line. I think given that over half of families in the UK are receiving some type of state support, even those that might have small effect can have major implications on our population health. We need to ensure that all changes to universal credit or any welfare change is maximising health benefits and minimising health harms. It's crucial, really, that our government includes a robust evaluation of health impacts in its evaluation of universal credit and other welfare changes. And this can only be achieved through health assessments of any change made. The UK government has commissioned an evaluation of universal credit. The evaluation framework only included assessments of labour market outcomes, and there's no plan to assess the health and wellbeing effects. And there's no point having a welfare policy that is moving people into employment if that's also causing distress. Welfare reforms that generate mental health problems, it's unlikely to be cost saving if it's pushing people into other services and into health and social care. And we know that a system that is moving people into work where work is not paying is untenable. So just my last final comments. So within the welfare system itself, from a health perspective, it is important to ensure that the benefit entitlement is adequate to live a healthy life. And this includes reducing uncertainty around the benefit assessment, implementation, and delivery, which is maybe where we can talk about basic income playing a role. So a system that respects those claiming, respects their individual needs and potential needs for further flexibility and dignity is paramount important. We need to put health and health equity at the heart of welfare policy. Thank you.
Thank you. Yeah, what a stark way to start. Thank you. Do put any questions that you have. I saw one about a citation. I wonder, Sophie, if you could dig that out and pop that in the chat. Any other questions that you want us to ask in the discussion, please do start sticking them in the Q&A. When we do the Q&A, Samuel will tee you up to ask that question by sending you a private message, and you can either make that comment or ask that question yourself, or you can ask him to ask it for you. So yeah, keep an eye out for a message from Samuel if you have put a question in. We want to hear your questions. Over to Jen.
Cool, thank you. Thank you, Sophie, for setting the scene. I'm going to take us and talk us through some of the why, and provide a bit of the story and a bit of the context and research around what is it that links the two together. How does our circumstances, how does this stuff we're talking about link to our mental health? I'm going to do it like really, really quickly because I'm on a time, I'm timed here. So I'm going to run through this very quickly, but I'm very happy to take questions. And it's a very complex topic, so I hope we get the messages across is what I'm saying, but I'm happy to take questions and share the slides for you as well. Okay, so so just for context, I'm speaking from Psychologists for Social Change here, and we've got a paper on this as well, and we've got a number of different other papers on our website, which I think the link has been shared to, which you can access if you want to know more. Okay, cool. So I don't know if we can see this. The people, my face is in the way, but so this is a like overview. So I'm not going to go into the depth, but I'm going to go at like kind of top level to give us a story to hang this together so that we've got a narrative that we can use to have this conversation. So at its simplest form, when we're talking about mental health problems, I find it helpful to think of that as nervous system overwhelm and loss of connection with the self, others, and the world. And I'm just going to talk us through what do we mean by that, and then link it back to the conversation we're having about economic justice and having a basic income. So when we're talking about nervous system overwhelm, you may have seen this before, and you may have heard of fight and flight and that response that we all have. What we're talking about, that's our nervous system, and we all have that, and we're all born with a version of this. Now, some of us are born with the ability to do this, like to use the system. Some of us are born with a more sensitive system that needs a little bit more scaffolding and support around it to get it doing the things that it needs to do. But we're all born with this, and we all have this. This is really important piece of the puzzle in terms of understanding our mental health, because to be in a relaxed state, to have a nervous system that's kind of functioning well, we're down in this green space here. And it's when we're down in this green space that we can be curious, we can show compassion, we can experience joy, we can be present, we can experience a sense of safety and connection to other people. But it's very normal for us to move through into a fight, flight, or into a freeze state across the day. As we're doing our talks now, Sophie, like that's not going to be a nice, like relaxed place, but it's a normal level of fluctuation that we can have. And we'll move through this on a daily basis or on a kind of general basis across our life. And we're moving through into a flight state, which is to move away from it. So I don't want to do the talk, I'll just go away. Or into a fight state, which is where we may experience rage, anger, irritation, or frustration. Where we're in flight, we may be experiencing panic, fear, anxiety, worry, or concern. And that's an I can do phase where we feel like we can take some kind of action. But when we're moving up into the top layer in the blue, where we're hitting overwhelm, in this state, we kind of talk about this as nervous system dysregulation. We're not regulated, we're not feeling safe, we're getting dysregulated. But when it gets too much and our system's overloaded, we can tip into overwhelm. And that's into that freeze state, where we may experience helplessness, depression, numbness, disassociation, feeling full of shame, feeling trapped and powerlessness. And that's an I can't do state. It's a very paralyzing state. And the key things to note here is that when we normally talk about mental health, we talk about you get anxiety or you have depression, and we list the symptoms that lead to a diagnosis of anxiety or depression. But what you can see here is that anxiety and depression are warning signs, or they are symptoms of nervous system dysregulation or nervous system overwhelm. They are indicators that there's something else going on. And it's really important for us to pay attention to that and understand that depression and anxiety is therefore not the end product. They're just part of a broader story that we need to tune into. So we all have this system, but if we don't get our needs met and we don't get the things that we need right from the go, then we can stay stuck in these fight and flight or freeze stages. And so as we may accumulate adverse experience, or we have lots of negative experiences, we don't get our needs met, we can stay more stuck in that. So we may be stuck more, our baseline may be more up here, or our baseline may be more up here. Now, the important thing to take away from this is that we're not born with the ability to do this. We're not born with a nervous system that's regulated. We learn this through the relationships and the connections we have with other people. And that starts with our first primary attachment. So our first primary attachment figure creates what we call a secure base that helps us go out into the world to explore it. And in doing that, they watch over us, delight in us, enjoy with us, and they help us. But when things go wrong, but also when things get like really excited and we want to share it, then we come back into that person, to the people that are doing that, holding that safe base for us, and they either protect us, comfort us, delight in us, and share in that with us. But importantly, they organize our feelings. So if you've ever seen a mum, for example, carrying a young baby of a few months old, talking to it as if it's going to respond, shaking it like, oh, I wonder if you're feeling this, or have you got a, Sophie, you'll be able to do this. I'm sure it's very familiar at the minute. I wonder if it's this, there you go. I wonder if it's that. And we're not doing that for ourselves. We're evoking this system. We're doing that to start to help the child learn to connect their emotions to language. And it's through that process, and it's through these two interconnected processes that we learn to do emotional regulation, and we learn to do nervous system regulation. Our caregiver soothes us and helps us connect our emotions to language. And we do that through being bigger, wiser, stronger, kinder. And the important thing to take away from this is that we don't just stop needing that or having that in childhood. This stuff is with us for life. So we don't turn into an adult and then we're like, right, we're done. We've learned how to be regulated. We've learned how to do connection, and that's it. We can only be as regulated as the people we interact with on a daily basis. And so as adults, this stuff is still live for us, but in every situation that we're in, this stuff is playing out for us. And this is really important for the conversation that we're having, because when we're talking about nervous system dysregulation, we're talking about circumstances that are traumatized and surviving. And that's circumstances that are harmful to a person, that are full of humiliation, shame, fear, isolation, loneliness, feeling trapped and powerlessness. And I like to articulate this on a spectrum, the continuum of relational health. And often we talk about this from a trauma lens. So you may have heard people talking about being trauma informed or trauma aware, but that's only the deficit end of this model. They're only talking about when things have gone wrong, when we're in dysregulation, or when we're in overwhelm. What we don't often talk about is how do we get to the good side, how do we do nervous system regulation, and how do we create the psychosocially healthy circumstances in which a person can thrive, in which they can have good mental health and well-being. And those are circumstances that are based on access to agency, security, connection, meaning, and trust. And you can hear from what Sophie was saying is that some of the systems that we have, the public service systems that we have, aren't organized around psychosocially healthy principles that create agency, security, connection, meaning, and trust. They're largely organized around the things that we know that are harmful to us, that cause us psychological distress or traumatizing, which are provoke or evoke a humiliation, shame, feelings of isolation, loneliness, feeling powerlessness, and fear. Another way of looking at it is like this, is that if we want to understand our mental health and we want to address it, we need to dig deeper. We need to go beyond the medical model, because there are no specific genes that have been identified for mental illness. And the chemical imbalance theory has been debunked. So what is it that's going on? They need to move beyond pharmacology then and pathologization and the individualization of this stuff. And we need to understand what is the stuff that's going on around us in our environment that's impacting us. And there are some examples given here of which poverty and also not having access to economic means or economic injustice is important too. And that's to move us away from circumstances that are creating humiliation, shame, isolation, loneliness, and fear, and we're thinking about how do we create circumstances that can allow people to have agency, security, connection, meaning, and trust. And that's across all the different layers of their life. So that's at the individual level, in the family level, but in our communities and our institutions that are around people, but then in our policy and practice as well. So we need these things not just for ourselves, but in all the different layers that surround us and interact with our lives. So then anxiety is normal in an unjust society. And Sophie, you alluded to this as well, but there's an absolute correlation. But we've understood this, that there's lots of research from adverse childhood experiences, adverse community experiences, and beyond, that's clearly demonstrating that poverty or adverse circumstances is linked to mental health. And when we talk about that, we're not just talking about anxiety and depression, we're talking about all of the different diagnoses. We're talking about mental illness, or we're talking about your diagnoses of things that get labeled as personality disorder, bipolar, and schizophrenia. We're talking about those as much as we are talking about anxiety and depression as well. So we're talking about the whole continuum. And it's, I think, helpful to think of it as a continuum as well. And if we're going to summarize it and take away one important thing, if you just remember one thing, what we're talking about and what the evidence base clearly says is that it's our circumstances that largely determine our mental health and that are correlated to mental illness and ill health as well. And our postcode is therefore more important to our mental health than our genetic code. What it means is we need to really understand what are the circumstances people are living in and what's going on in our communities. I don't know if people are familiar with ACEs, adverse childhood experiences. So that's just in summary, that's if you have toxic stress, so lots of stress in our early years, it's correlated and linked to poor physical and mental health in our adulthood. So those toxic stress is linked to adult health and adult behavior as well. And what we mean by that is you're 4 times more likely to get cancer, diabetes, and have heart issues, as well as mental health problems, including substance misuse problems as well. And what this diagram here, which is a piece of research exploring adverse childhood experiences, and what it says is, if we want to build, if we want to look at what the protective factors are for that, they're coming out as participation in sport, community engagement, having access to a trusted adult, but perceived financial security is also coming out as a key thing. So we're thinking about what are the circumstances that we need to create, providing people with that sense of security so that they can have a sense of agency, security, connection, meaning, and trust is absolutely linked to our financial experience as well, because that's how our world operates. And that's all from me for now.
Thank you so much. Yeah, what I found both the foundations there, that I think what Sophie and what Jen said. I think, yeah, we sort of take for granted that we know what we're talking about when we enter into these discussions about social security, or about what good social security looks like, and even what mental health is, and what the factors are. Yeah, fantastic start there. Thank you very much. Another reminder, do stick questions or comments, even, you know, we can bring people in. It doesn't have to be a question. We'll listen to you and your wisdom as much as asking our panel and myself for input from us based on questions. I'm going to start off while we wait for a couple more questions to come in, and as we always do, with a couple of my questions. And I wanted to take this time to think about kind of three components. What doesn't work now, and what's the evidence? I think we've already touched on a lot of this, but it'd be good to sort of summarize that in terms of social security specifically. What a system that does work for mental health looks like, and whether you see basic income as a component of that, or how that might be a component of that. Because as we always say, particularly in these sessions, that basic income is not one thing. There are many, many different ways to build a basic income, and there are many, many basic incomes that wouldn't function well, or wouldn't improve, or wouldn't solve any of these problems around financial security to improve mental health outcomes. And then the final question is around what needs to be done, what needs to be broken down to build a system that does work better. So yeah, if we start from the top, and what doesn't work now, and what are the key parts of that? Just revisit what we've already said, I think. Jump in, yeah. So
Shall I go first? It's hard when you don't know who. I don't want to interrupt. Okay. So what doesn't work? Well, if you're looking at the context of the whole social security system, not just universal credit, we were talking previously before we started, but as elements of the whole security system, the austerity program that started back in 2010 was detrimental, not just to mental health. It was happened in coalition with, you know, the cuts to services that were, you know, needed for good mental health for us all. But universal credit was an element of that. You know, we had the benefit freeze, the bedroom tax, the 2-child limit that's introduced in 2017, that are designed to, you know, save money. And I think it's, you know, they were very successful at saving money. I think the government saved something like £27 billion. But those cost savings were definitely spent elsewhere, whether it was through their money or other money trying to support the fallout of what we saw going on with the social security system. It is definitely broken. If you're talking about specifically universal credit, I've obviously talked about it. It's not just, oh, we've had this change. It's been used as this sort of, people describe it as a simplified system. It's one thing that will help lots of people, but actually it's very rigid in that. And the things that we saw within the pandemic started to break away some of those rigidities. So the £20 uplift, because there was an understanding that, oh, actually this isn't enough to support people. They changed a lot about the system. So there's a verification system within universal credit, which can be very hard if you don't have a fixed abode, or if you don't have access to internet. All of those kinds of things make access to universal credit really hard. I think fundamentally we need to be treating each other with dignity and flexibility, in understanding that we are individuals, and, you know, everybody has something different going on in their lives. It's not a one thing fits everybody, which it seems to try to be at the moment.
thank you. Yeah.
I'll just add from a devolved perspective, but it's not the same story everywhere. And I think, I can't speak for Scotland, but in Wales, Welsh government would say that not having devolved powers to manage social security is being a hindrance. And there's much more talk these days about being able to do that, and that not being seen as a nationalist thing, but seen as a useful thing in terms of devolving power to the people, so that we can make these decisions locally, based on local need. What I would really like to see that the system share out that power, so that different governments can start to make local decisions. And what we're seeing in Wales is that when those decisions are being made, they're not being made by putting the problem on the person. That we're not seeing that, you know, if that the thing that's incentivizing the system isn't that, well, if only you were in the right, if only you did the right thing, then you would make your way to make ends meet. What we're seeing is governments that understand that people are trapped by their circumstances, and so then they're making different decisions. So at a UK level, we're not seeing that shift yet. They're still putting the problem on the person and leaving it for the person to resolve. Whereas we're seeing other governments recognizing the impact of circumstances, of what adverse circumstances impact, how they impact on people. And it would be great to see them gifted more powers to be able to then take that further. So I think it's more than just changing the current system that we have, it's changing the way we do and the way we approach things at a broader political level, and devolving things more locally across the UK as well. I think people in different parts of the UK would welcome that. We've got small parts of devolution across the UK, but I think devolving the power of to determine social security locally based on local need is really important, because it's not one story for everybody.
Yeah, really important. I think there's something in this, and similarly to what Sophie was saying about we need to include assessment of health impacts and mental health impacts of reforms in the way that we build policy moving forward, is taking collective responsibility for social problems. And that's the purpose of the welfare state and of social security, is supposed to be policy that takes into account the complexities of life and all of the challenges that we face and improves that. But it's very easy to not take responsibility for that when you're not looking at the right components of it and what doesn't work. But the evidence is so stark. Yeah, I think around sanctions, around the level of sufficient level of income support is not something that is offered through social security at the moment. And yeah, really agree with the shift during the pandemic being, yeah, universal credit became a lot more basic income like during the pandemic, because it was unconditional to a certain degree, and it was a little bit higher, but it was still not perfect, right? So we need to take responsibility for fixing that. Yeah, sort of on this, I wondered if there sort of a key points at which people are currently failed through as they move around or through the social security system, that you know, maybe a basic income or income isn't the answer, money isn't the answer, it's other different types of services, or interested to hear if there's.
Sorry, can you say that again? I'm a little bit distracted.
I'll go Sophie. Yeah. I think it's important to talk about the social determinants here. And so we know the social determinants of health. We often, when we talk, when you were just speaking previously, I was going to say there's also something around how the pandemic has helped us understand mental health differently. So you say we move towards a more kind of basic income kind of thinking. I think the pandemic also helped people see that mental health is about circumstances, and I can be impacted by this. This is impacting me. And so we're in a kind of a moment where people can hold those two experiences. And I think that's really important, because one of the things I think that keeps things stuck is the disconnection of mental health from these conversations, and thinking of mental health as something that, you know, happens to the 1 in 4 people because of biology and because of personal failings and things, which is absolutely not true, which is not what the evidence base says. And so we need to be holding those two conversations and encouraging public conversation that understands mental health through that lens rather than a medical lens, through a social lens. I think that's really important. But to do that, then we have to understand the social determinants of health, and we have to include mental health in our understanding of the social determinants. And it's about addressing all of those: access to housing, safe and secure housing, and shifting housing policy as well, so that it's not causing people problems is absolutely crucial. But we also need good education, access to transport, and a whole myriad of other things as well that sit within that box of social determinants.
Absolutely. Yes, complex picture.
The only thing I was going to add is I totally agree with everything that Jen has just said. I think we need a shift in government to understand income poverty as one of the social determinants of health. At the moment, we've seen a shift from sort of what poverty is. They've tried to, back in 2016, there was a redefining of poverty within government away from income related poverty to what I would argue is the consequences of poverty, so debt and breakup of family, family breakdown and things like that, and alcoholism. It was it was a shift away of income poverty in a way to negate responsibility.
Absolutely. Esther's comment here about the part of the problem is that people are struggling who aren't eligible for any kind of social security. For example, young people working in the gig economy on a self-employed basis who don't seem to be covered, which, yes, see that all the time. Security of a basic income would improve the mental health and free up creative energy to contribute. So yeah, moving forward to the next question of what does a system that works for mental health look like, and is basic income a component of that in your mind?
Yes.
Yeah.
Yes. It has to be in terms of providing that security. We need security in order to thrive. It's really that simple. We need other things as well. So we need our material needs met, but we also need our relational or emotional needs met as well. And so meeting our financial needs is part of the story. It's not all of the story, and there's also going to be a lot of healing that's need to be done to break that cycle. We talked about poverty and mental health being a consequence and a cause of. I think there's an important conversation to have around if we just give people money and we meet those needs, but they're not healthy enough then to take up other opportunities, we're only doing part of the job. So it's also about providing spaces within communities, reconnecting communities. We've had a huge disconnection of society through the pandemic, and it's about nervous system regulation and connection to have good mental health. But that was happening before. We speak about our century as the lonely century. The breakdown of social fabric and social connection has been happening for a very long time, and that's key to addressing this cycle as well. We need to do both, and so it's a poverty and mental health or relational health strategy and approach that we need.
Absolutely. Yeah, I came to basic income through sort of third sector, a lot of community level projects, and the fact that I spent all my time talking about money really is a strange thing that couldn't have expected to happen, but it just feels like it's that foundation. We often talk about basic income as an income floor, something that people can't fall beneath. You can't be that completely isolated or excluded from society based on not having access to that foundation of income. Sophie, did you have anything you wanted to add? I can keep talking if you need a moment.
It's proving more harder than I thought, because he's interested in all the faces that he's seeing. And I think one of the barriers that we see is really sort of changing societal perceptions of the of the utility of having it and seeing it as a as a collective and as something that everybody deserves to have. And I think UBI is novel in that, in the same way as I get child benefit. Everybody gets is eligible for child benefit. If you earn over a certain amount, you have to pay it back, but but it's not seen in the same way as many of the welfare systems currently is. There's a negative connotation, and that's something that comes up within the qualitative work that in the early findings that I spoke about, which is part of this NIHR grant, where colleagues are really finding a lot of self-stigma for having to claim this. And actually, if we were to redesign the system, we'd need to change people's perspective of what the system is. And that also starts from the bottom up, not just the top down. I mean, the amount of people you hear from that just have a very specific perception of needing to use the social security system is a real shame, given that we know that it's something like you're always 2 paychecks away from homelessness. It's a shame.
Yeah, I think this idea of collective responsibility and localized response, that like Jen was saying, devolution of powers, But also, yeah, there's so few meaningful investments in communities that involve money, that involve being able to give money to people or to projects or to whatever, where you can just see that that is what they're screaming out for, and that is the limiting factor to healthier, happier, or whatever it is, the outcome that we're all agreed needs to happen. And we did a project a couple of years ago at the end of 2021 with some solidarity funds that have come through the pandemic, working with their communities to do things like shopping for their neighbours, you know, these services or these helping hands that they're providing. And they realised quite early on that people just needed a bit of cash in their pocket, that actually they could do a million different things and they could have a massive volunteer workforce, but actually if they managed to get together a pot of money that people could apply for, so they can, you know, without questions, use that money for whatever it is that is most pressing in their life at that point. And a lot of those people were people with no recourse to public funds through their immigration status, massively excluded and left behind by all our systems here in the UK. And we work with them to do a crowdfunded basic income month and compare those payments to basic income. But that ability for a community to respond directly to the needs of that community, I think, is so key and so missing from the way that national policy kind of looks at these things at the moment. I think Sophie's points moved us on nicely, though, to what needs to be done and what needs to be broken down to build a system that works better. And actually, before we came on this call, we were starting to get into a really interesting conversation about how we do that. And Jen, I thought your points were really, well, concise and really aligned with the why we are a conversation, why the basic income conversation is the way we've approached this, in terms of when, you know, shifting people, allowing people to even engage with a conversation that feels quite hostile when they look at what the idea is initially and maybe has an emotional reaction. I'll let you talk more on that.
You're making me try and remember what it was I was saying.
It being an emotional conversation.
We were talking about why some people are maybe less responsive or more resistant to this kind of conversation, and I was just offering that sometimes that's a threat-based response as well. I'm losing the train of thought now in terms of articulating it, but we were saying where we were just saying there's no amount of evidence that's necessarily that you could throw at that. We were talking about conversations happening on Twitter around this event. There's no amount of evidence because it's an emotional based response, and so we need to tune into what is that. And I was just saying some of that is coming from the fact that we have been fragmented as a society, and so we have lost connection, and we've seen that in like the far right movements where people are seeking belonging and connection through the othering of others, and so they're seeking that stuff at the consequence of others, and we're doing that because we've lost our sense of connection and our sense of solidarity and pulling togetherness, because we've been isolated. And it's because, I'm waffling now, sorry, but because when we're isolated and we're feeling alone and we're feeling like nobody's with us, our threat response is triggered. And you know, I was saying about fight or flight or freeze, we can enter fight. So when we're feeling lonely and disconnected from others and we feel like the world doesn't care, our response can be more aggressive and it can be more hostile, which is what we're seeing happening, which is kind of what we can see. And sometimes when people are refusing to engage or don't want to engage or not kindly engaging with an idea, sometimes maybe it's coming from the very stuff that we're trying to address as well. And so to not then shun those people or to think badly of them, but to kind of think what's going on for them, what might be the unmet need there. I don't know if that's what you were meaning.
Yes, absolutely, it was. Not waffling at all, but exactly what I meant. Yeah, and this is sort of, and this will move us on to our first question for the Q&A. Do let us know if you have a comment you want to make and keep sticking questions in. But this is exactly why we are a conversation, and we sort of came to this. I'd been talking about basic income for a couple of years and realised that all of the meaningful progress that I felt like we'd made through that work came through quite a lot of talking and allowing back and forth, allowing space for disagreement. And that's, you know, our basic income conversation toolkit talks a lot about how to hold that space and think about how to talk about the policy and our enthusiasms for certain components of it, about it being unconditional, it being universal, and what we see is the really crucial social justice components of basic income, but understanding that some people, they feel quite threatening, or and I think deservingness is a really key component of this, both either or, but some often both, almost always both. I don't deserve that, and they don't deserve that. You know, I don't deserve this unconditional money for nothing, because I've been told forever that I have to work for what I get, or that, you know, this is all a fight. And they don't deserve it because I've been told again that they're undeserving, they're taking advantage of the system, and that's having an effect on me. But the idea, again, I think Sophie said, that we all deserve this, and that this foundation is really crucial to us all. Sophie, did you want to add anything to what needs to be done, what needs to be broken down to build a better system? I think your point about assessing the health impacts and mental health impacts is really key in building that in. I wonder if there's anything specific on that.
I think in any change, big or small, you have to consider health as a primary, you know, outcome, not just what is happening to income. But I think the other thing is to stop thinking so short term. We've got a lot of research out there that is looking at the short-term health effects, and to be able to see the longevity is where we'll see the big money impacts that we haven't been able to see so far. But for that, you need a lot of money and a lot of people, you know, to agree that it's worthwhile. I think people shy away from that as a possibility, because, you know, like, if you think a government changes every 4 years, they want to show effects largely on the economy, but over that 4 years to show that they've, you know, in order to get re-elected within the UK. And yeah, you need bigger ideas than, you know, we need to go beyond that 4 years to actually think of ourselves as a collective, and that there's a long-term goal here that doesn't just include us as people and communities, but also, you know, the world in which we live. You know, think about the climate crisis as well, and you know, it's all connected. Yep, somebody's just put in the chat, Finland is the happiest country in the world despite not having UBI. That's right.
So we're going to start moving on to questions. Samuel, I'll hand over to you. I think bring in Robin for a first one.
Yeah, let's bring Robin. Here we go. Rob, do you want to say your question?
Yeah, it's really interesting. I don't know if you can see me. I can only see 3 people. But basically, I'm just interested in UBI as a working model, really, to create equality, equity, reduce stigma of the benefits system. And I just wonder if the UBI conversation works with other organisations working on UBI, because I think that's half the problem. We've got lots of people, the system breaks us up, like the 4-year election process just breaks us into basically 2 systems, left or right. There's a lot more to life, and there's a lot more to community than left or right, just the same as there's a lot more to left or right than UBI, you know, I mean. Indeed. But it's a step in that direction. So yeah.
Thank you, Rob.
Sorry.
No, it's great. Yes, we do, like, almost exclusively work collaboratively. We work closely with the UBI Lab Network on a lot. And in fact, we're sort of really digging into what do we need to bring into the basic income movement to meet, sort of put us all together and bring us in closer to make it less confusing for people entering the space wanting to do something with it. And I saw, was it South Devon that you're interested in doing some work on? So if anyone on the call wants to connect with you, maybe use the chat feature.
Absolutely.
Cool. Thank you, Rob.
Okay.
Samuel, will you bring on our next question? Tell us who it is that we're speaking to.
Sorry, we're bringing in Mike. So just bear with me 1 second. Mike, do you want to come in and say your question?
Yeah, hi there. So I've just started reading A World Without Work by Daniel Susskind, and one of the stats right at the start says that depression amongst UK adults almost doubled at the start of the pandemic. So my question is basically, are there any findings from the pandemic that would help with promoting UBI and the effect it would have on mental health? That's it, really.
Thank you.
Thank you, Mike.
Does anything spring to mind, folks?
What was that? Are there any stats? Could you just...
Any research on mental health during the pandemic that sort of applies to the basic income debate, I guess, around conditionality probably, or
yeah, so I guess there's some qualitative work. We haven't been able to see the quantitative findings of, if we think about the £20 uplift, which I mean is a tiny amount, but we've already seen it wasn't given to everybody. It wasn't given to legacy benefits. It was specific to universal credit. But there was people that were, historically had universal credit that received the £20 uplift, talked about the positive effect that it had on them, because it was, about £1,000 extra a month that they were getting, which was an absolute lifeline. There was still fear of it going, but it was early evidence, and I think people are now starting to be able to look at that from a quantitative perspective anyway.
thank you. So yeah, I suppose keep our eyes peeled maybe for those bits coming out. Anything spring to mind for you, Jen? You can move on to the next question.
No, you can, Sophie, that's your bag, Sophie.
Yeah. Samuel, what's the next question we have?
Yeah, hello. Can you hear me?
Yes, perfectly.
Yes. Yeah, thanks, Sophie and Jen, for your very interesting presentations. Unfortunately, I have a very difficult question for you. I'm a retired public health academic myself, and believe in sort of policy-based evidence rather than evidence-based policy. So my opinion is that because actually know what you have found, especially what Sophie presented, and it's actually the aim of the system to intimidate and put people down. And so I don't think your evidence will convince the actual decision makers, because that is the aim, the unspoken aim of the system. So how do you think your evidence can help to change the system? So I know it's a very difficult question, but that's unfortunately the.
That is okay. I like the difficult questions. It just gives me more to think about. So in terms of the first project, that is something that I presented to government. I presented it to the House of Commons. They had a select committee where they did an inquiry into universal credit. So I presented my findings there, and that fed into recommendations to changes within universal credit that the House of Commons made to the government, which the government responded to. I can't say whether much changed, but it was heard. And I was also involved in presenting the findings to the all-party parliamentary group on universal credit and mental health. So there are MPs that are aware of the studies, that are sort of fighting for change within the system, changes within universal credit. And the only thing we can do is present the findings and give the evidence and hope that changes are made. So separate to that, I did some work on poverty, around income poverty. I can't remember whether I mentioned this earlier. In 2016, the government were changing how they defined income poverty, and we did a piece of work around the importance of retaining income poverty and how we use that as a way of comparing with other European countries, how our country is doing in terms of poverty rates over time, and that fed into many other researchers and organisations also presenting the same findings, and that led to the government retaining that measure. They didn't have to then share it with government, but it was retained. And so in small ways we make tiny changes, but not the big changes that perhaps we want to see as quickly.
Well, and I can say as in our work pushing for basic income and doing the political side of it, if we don't have evidence like the evidence that you're presenting, it's much harder to make the case. The starkness of, like I said at the beginning, of being able to say, well, this is what you've put in place and this is the effect it's having on people, unless you are making that choice to do that, then
people are getting much better within research at trying to encourage and engage with government early on in research now, to try and sort of start those conversations right at the beginning of research, get a stakeholder, get them involved at the beginning. And I think that's one way that we could definitely try to push an agenda, because if somebody's involved with research and believes in the research early on, then it's harder to be combative with the findings.
Absolutely.
It's like tapping into the underlying ideology, if I've understood right. So
Exactly.
if we're not tapping into that and we're missing those assumptions, then it's going to go. We have the same problem in mental health. So we use a diagnostic system that isn't scientifically valid. So any research that we do in the terms mental health, that, you know, like the definitions that we have, is starting from a poor point. It's not starting from scientific validity, but we take that and then we do research and then we say there's outcomes, that we're not starting from addressing the underlying assumptions and the underlying things that were built, that system was built on. They're important to flesh out, but I think it's complex because sometimes you need to speak to the system in the system's language in order to move it on. But then for some people, you need a new story and you need to change that narrative. It's messy.
Yes, it is messy. I think Alex had a technical issue with some headphones, so we're gonna have another go to hear from Alex. You should be able to unmute now, Alex.
Hi, everybody. You hear me?
Yes, we can.
Oh, magic. Yeah, it was just to expand basically on what I think it was Jen that raised the issue of devolved powers on social security. Well, we have some social security powers devolved to Scotland, and the difference up here now is quite dramatic. The consultation that the Scottish government had for setting up Social Security Scotland was really extensive and in-depth, and they took on board a lot of what we said about mental health issues and so on. So now we're taking personal independence payment. It's now adults disability payment in Scotland, and there are no private companies doing assessments. And the government has said it treats welfare as an investment in the people, which is a completely different approach, of course, to what we're used to from the DWP. Having said that, the government's also stated that it's going to introduce a minimum income guarantee by 2030 as a stepping stone towards basic income. Well, we'll see what about that. I have not too much confidence in that, but the problem with MEGA, of course, is it's still means tested, or at least they haven't made any move to say that it's not going to be means tested. Yeah, so take the adult disability payment, the differences are different approaches here. Yeah, there's no assessments by private companies who said that, but they also have people in every local authority area of Scotland that you can approach for advice and help on how to complete the forms and how to go through the system. You also, as a disabled person, have a right to an independent advocate to help you through. And it's a right. It's not just a well, you can or you can't. You've got no choice. No matter if you want one, you can have one. So there's quite a bit of difference in the way that it's being treated. It's early days yet, but I've been helping a lady with her PIP claims over the past 4 years, and she's been refused twice. And she went through with she had a great case and sailed through it with adult disability payment because it was treated not compassionately, but you know what I mean. It's on the merits of the case. They weren't there trying to stop you getting it. They were trying to find out the truth, and that was fine too. But there's other things going on up here, like incorporation of international human rights legislation, which is going to bring us in conflict with the UK government and the rights removal bill, of course. So it's quite possible you're going to have a two-tier human rights system in the UK because we're incorporating disabled people's rights, women's rights, race. What was the other big one? Oh, children. There's no international treaties for older people, but we're bringing in those rights too, and also environmental rights. But economic and social and cultural rights are also going to be incorporated within the new human rights bill to be presented to Parliament before the end of this term, which is 2015, and I'm on the government board that's helping them do that. So
Thank you, Alex.
The difference of approach is what's really important, and that's the key to making a big difference in people's mental health.
Definitely. Yes. Thank you for that. Some interesting insights into different approaches in Scotland. I wonder if Jen or Sophie wanted to respond on, particularly perhaps the means testing component of minimum income guarantee.
Yeah, well, we'll see how that goes.
Thanks, Alex. Speak to you soon.
There is a broader conversation around cultural conversation around how our public services and how we think about that stuff. So it's shame based and it's punitive and it's fear driven. We saw in the slides that humiliation, shame, isolation, loneliness, and fear are psychosocially unhealthy for us. They're correlated to mental health and mental illness. But those are the things that we accept. They're in our mental health system, they're in our social security system. That's how the DWP work, but that's how education work as well. So it's really ingrained, and we do it across the lifespan, and that's going to be a massive shift, I think, a massive cultural shift for us to move away from those ideas.
Absolutely. Do you have anything you want to add?
I can't think of anything to add. It's just it's having something that's means tested or versus not means tested. I think somebody else put in the chat about whether it should be based on family or individual level as well, which is kind of connected. Is it means tested on household income, or or is it on the individual? Universal credit is claimed as a household, so a lot of people. One of the early problems we saw with that was people that are living with an abusive partner, and then choosing to leave that partner, not having experienced universal credit at all, not getting the finance, any money from universal credit, and claiming universal credit on their own as an individual can sort of inherit any debt that has accumulated from that household. So I would say, if anything, if you're shifting towards universal basic income, it should always be based for an individual, not for a household. So if you've got a household of one, it's for that one person, a household of two, a household of five, each person, because each person has their individual needs, each person has their individual experiences. And then on top of that, you would want to see some kind of assessment based on other needs. So thinking about, disability and extra support, accessibility needs, but that if there was some kind of baseline. We
tend to say that housing would also need to be considered outside of it, just because of the housing market in the UK. This is really interesting that we had Donald Hirsch, who does a lot of work with the Joseph Rowntree Foundation on the minimum income standards. So they speak to people across the UK about what they see as the socially acceptable standard of living based on income, and turn that into a number. And that is sort of defined on a household level because of economies of scale. And I remember the first time I heard that phrase, I have no idea what it means, but that just means that it's cheaper to live in a house with other people who are contributing to running that household than it is to live on your own. And his point about basic income was that it's unfairly, because it's individually, and we see that as a key component, a defining component of basic income, one of the key 5 characteristics. If everyone in a household gets basic income, then that household is
better off.
Even more better off, because they get
rising inequalities.
But this is where the sort of building the floor to build a life on kind of component of the income, I think, comes in, and you can design that creatively, and means testing might have a role, but I think needs testing is more important to that.
I think needs testing is fundamental to all of this, and you think this also involves a change in how we are valuing money at the end of the day, and the cost of living crisis has shown us how abhorrent a lot of the things that have been happening for individuals and for families over the last couple of years. I do think the price of housing markets, what people that are privately renting versus homeowners, you see huge inequalities within this. I do think it's interesting hearing about Scotland, because Scotland also have a lot of within the universal credit study that we're looking at, we see a lot we're seeing the effect of universal credit within the qualitative study. Again, these are really early findings. I've been told there's potential for it it'd be interesting to explore whether the effect is as great in Scotland, because there's a lot of protection laws in Scotland that we don't have in England. And like, if you think about the housing market, that, like, I guess in England, renting is very much in favour of landlords in England. There's a lot of protection for landlords, whereas in Scotland there's a lot of protection for tenants. And I think we need to basically stem that out to all areas of society. Yeah, a lot of this stuff is about access to things, access to health, access to services, access to a bus. You know, we've had so many cuts to services in the last 12 years. People are having to get 3 buses just to get to work. You know, and all of that has a mental health, you know, the mental load component associated with all of these things have an effect on our physical and mental health as well.
Yeah, absolutely. Yeah, the question, the anonymous question that so I'll ask it on their behalf about level. I wonder if you have a sort of gut sense, maybe Jen, from your work in communities, about how that could be determined, I suppose, with sort of asking people what that level should be, or whether there's a sense of what that is. Maybe the minimum income standard's useful there.
Say that again, sorry, Claire. I was reading one of the when you started. Do you mind?
The question around how much should a basic income be? I wonder if you have any thoughts on, and a gut instinct of what that might be. Maybe not a number, but what needs that would need to meet, or whether there's a process of determining that locally, similarly, you know, working with communities to determine that.
I think that depends, doesn't it? Because if we're talking about universal basic services, and Sophie, you mentioned like access to transport, those are going to be very different needs and very different, like in different places, they're going to play themselves out differently. So that would then determine, you know, if you've got to get 3 buses to get into town is different to 1 bus, and if, you know, there's only 3 of you versus 50 of you on that bus, then there's different things that are going to play out. But if we're talking about a combination of that stuff, and it depends on then what you have else around you. So if you're in London, the housing market is very different to if you're in the Welsh Valleys, and there are pros and cons to both of those. So it's going to be locally determined, I think, but that's already playing itself out. I was reading the comment around class, around class wars. Yeah, I think that's tapping into some of what you were saying, isn't it? These things are divided along those lines lots of the time, and we're not making things accessible and equitable for everybody. And that's, again, locally, Scotland is very different to Wales, is very different to different parts of England as well. So I find a number, I'm not sure, is the way.
No, that was an unfair question to ask. Pluck that out of the air. Yeah, yes, very interesting. I think the class component is really interesting because there's so many people have access to unearned income, and that's become such a big part of our economy through renting out properties, or, you know, whatever unearned income that is just passive income from various different sorts. But you have to have a certain level of wealth, or at least privilege, to be able to access that within a lifetime. And a basic income would be unearned income, and it should be, you know, in my view, funded through collective wealth generation, that we all, you know, the prosperity of a nation is based on every person in that nation, and currently we aren't benefiting from that, or many of us aren't benefiting from that because of our standing. It'd
be interesting to hear your thoughts, and people in the audience thoughts on what age you think somebody should receive universal basic income. From all the work I do, the people that are affected the most are always children and young people. We've seen child poverty rise exponentially since the beginning. Yeah, 0. Okay, good. You know, exponentially, and it's often the voice that is never heard. Within research, you know, trying to give young people and children their voice, and you know, because they don't have votes to make change. Often, you know, it'd be interesting to hear what other people have experienced, or, you know, have they explored that.
Yeah, do put your thoughts on that in the chat if you have any strong thoughts. I do think it should be from birth and paid to the primary caregiver until 16 or 18. I think we need to do a lot more work with young people to understand what that should be. Maybe a different age, but I think it should be young people helping make that decision. But like you say, I think that income, you know, I think it's against the principles of universalism and basic income to not give children an income of their own, even though obviously a baby can't manage their own finances, but the caregivers, giving the caregiver that resource so they have that throughout their childhood, I think is really crucial. It might be a lower level because they don't have to pay their own rent maybe to their parent through their childhood, but you know what I mean.
I think that's a really important question. In Wales, we have a pilot project for children in care, and I think it's an interesting conversation when we think about those children who are in the care system and the disadvantage that they have, the circumstances that are around them, the links to adverse childhood experiences and mental health and all of that stuff, and then bring this conversation to that. How does it help those children, and what are the circumstances that it would help them? Yeah, because if we're talking about inequity and disadvantage and privilege.
Absolutely. Yeah, some good points in the chat. Adam saying that UBI given to those 13 plus as a method of being able to guide them to get used to that money. I think that's a really interesting idea. Agree from birth, Tom. It may need a different payment level at a certain age, 13, 16, 18, for example. Mike saying initial thoughts 16 or 18, and rightly most proposals suggest half a UBI or lower payment to parents, guardians. Rich saying 18 with an allowance lower than the adult UBI given to the caregiver. Yes, so sort of relative agreement there. Samuel, I think Rev had some interesting points in the chat, so we suggested coming in and making some of those on the call.
Yeah, I'm just thinking, my perspective is kind of the opposite of what you were just saying about the importance of localization, because I'm coming from a kind of global position. My background, I'm a psychologist, but working for the last 20 years as a psychosocial specialist in humanitarian settings with people affected by conflict and displacement. And it's a small kind of field, but we do have these guidelines which have been developed through consensus. Since 2007, we've had these guidelines on how to promote good mental health, prevent mental health problems, and respond to people who do have mental health difficulties in emergencies. And although it's emergencies, I really don't see that these things are not relevant. I've been back in the UK since I was grounded by the pandemic, and I don't see that these things are not relevant in the UK. The more I see of things in the UK, the more I see that the stuff that we have learned in humanitarian settings is so applicable here, and we don't seem to see it as relevant for some reason. We think, I don't know why. I could expand on that, but I won't. But basically, the thing I was trying to explain in the chat a little bit is we have this, it's a kind of pyramid to illustrate the mental health and psychosocial support services which are required by a population affected by emergencies, or any population, I think. And there's a consensus within this MHPSS field, everyone working in this field, who are ranged from psychiatrists to social workers and everything in between, that it's got to be based on a foundation of basic services and security, not only that they are provided, but that they're provided in safe, dignified and participatory ways, so that people have input into decisions that affect their lives. And there's a kind of, I spent a lot of my time when I was doing this work, working with organizations to help them to integrate psychosocial approaches into these basic services, things like shelter, water and sanitation, education, so that it was integrated into everything. Only when that's there can we expect people to be able to take care of their mental health and well-being, to support each other, all those things that we know are necessary. All the things like the next level on the pyramid is community and family supports, because we know if those things are not there, then there's going to be huge numbers of people who are affected in terms of their mental health. So those things are sort of standard and the basics in humanitarian settings, and yet here they're not. And there's a lot of evidence in humanitarian settings that we could draw on. We know that if people are struggling to access basic services in safe, participatory and dignified ways, of course they're going to have mental health difficulties. So it just kind of, having come from that world back into my homeland, it just strikes me as really odd, that we're not drawing on all of this knowledge and all of this consensus from other parts of the world. which is, you know, kind of the opposite to the localization thing. But I think the two things are not exclusive, are they? We can learn from other places and then think about how to apply them in our own specific settings.
Yeah, really fascinating. Good.
Yeah, I think you're absolutely right. I think that is the same as I think, yeah, you are in agreement in that it's about connectivity, and we will need services that are connected to each other, that place health and mental health, and understand that in each and every service that we're using, and take a sort of a universal approach. I agree.
Jen?
No, I agree. Our mental health services are in crisis, and they're not doing the job that they're supposed to do. The narrative about what mental health is about has been disconnected. I don't know whether that's easier to see in a crisis, that we're talking about trauma, and then there's something that goes wrong when we're locally talking, we talk about mental health. And we disconnect the two, and it's not helpful, and it's not helping our systems. It's not helping guide them to the right solutions.
Yeah, and Give Directly, which is a charity that does a lot of cash transfer programs, but you know, outside of the West mostly, or initially, yeah, apparently they're much more interested in applying that to the UK context now, and I think that says a lot on various levels. Hopefully something to do with the case making for cash-based policies like basic income, and unconditional cash-based policies like basic income. But I think it was also a reflection of the types of problems we're seeing much more, and be such a prevalence in the UK at the moment. Samuel, sorry,
last point, if you don't mind. I think I know the document you mean in terms of the pyramid of need from that work. I was involved in a bit of work with the Near and Bevan Health Board, where we were looking at community trauma, and we did draw on those models to try and apply them. And I do think we need to do that more. It's not in our language, it's not in people's kind of frame of reference that we would do that, and that we would talk about these things at that collective level. But I think there's real space and scope to take that thinking and those ideas, you know, of our basic needs and the pyramid of needs, but also, you know, the cyclic nature of that. So relational needs first, physical needs first. There's a bit of a chicken and egg there, and applying that to some of our most traumatized communities, but starting to think of not like deprived areas, but to think of them as traumatized communities, and use that as a way to shift and get people thinking about and applying those ideas. I haven't really seen that work happening in Wales really, or the UK.
Thank you. Yeah, some projects to kick off the back of this conversation. The danger of talking to each other. Samuel, you got. Thank you, Greg.
Yep, we have Greg. Greg made some really good points.
Hi all, thanks for your talks. A couple of questions that are both linked, if that's okay. The first off was, I know there have been a few trials of UBI, and there's a couple going on at the moment. Is anybody collecting any data on the kind of health impact of those trials? And then the second question kind of linked to that was, if anybody is, do you see the kind of patterns that you might expect? So do you see, I think, Jen, from what you were suggesting, people who have experienced difficult childhoods might be more likely to benefit. I wonder if you see that. And I wonder if you might also see with coping styles, if people have certain coping styles, they might have a better outcome versus, you know, if they have a negative coping mechanism. So if you use alcohol, for example, as a way of coping, you might, if you get universal basic income, that might be a reason for drinking less, potentially.
I think it's a really important question, and going back to what I was saying around, we need both. So we're not in a regulated state, so we need to be regulated before we can relate to others, before we can reason. And if we're not in a regulated state, I think Joseph Rowntree did a really good piece of work around it. Poverty impacts our decision making. So we're talking to there when our system is overloaded, we're not able to do that. So there is something around helping people create the right conditions to make the best use of that, which is where there's probably a conversation around services and having access to services, and it not just being about money, but also helping people relationally heal and have access to good you can call it coping strategies or ways of doing relationships and being able to heal as well. If you've not got that stuff from childhood, we need services to come alongside people as well to help people learn those skills so that they can feel safe and secure, and have good regulation as well. There's a huge health cost there. We do that for people, we bring that stuff down for people, we save a lot of money in terms of physical health. If we're correlating adversity in childhood but also throughout life to later life, diabetes, cancer, heart disease, etc., the big ones, as well as depression and things, there's a lot of money we could save there, but there's also a lot of people's lives we can improve, and meeting people's material and physical needs is part of that, but we're social beings, so it's also about meeting our social needs as well.
I can't remember who said it, somebody may be able to correct me, but if we inverse the finance that we had in terms of, if you think about age, we spend very little early on and then it goes up and up and up. If we just inverse that, I can't remember who it is.
I don't know, but I know that we spend 7% of our mental health budget on children and the rest go on others. So that, I mean, we need to invest in childhood, that's when we need to do it, but that's not what the spending is.
Yeah, and the theoretical underpinning of that is that you'll see how, if you're spending the majority in early childhood, and then you'll see this plateau later on, like go down, you'll actually see the long-term health effects. But that's, you've got to have the long-term lens. In terms of somebody looking at the health impacts of UBI, I don't know, but I do know that there's Kate Pickett wrote an article with colleagues last year. No, God, 2021, 2 years ago, on how to do that. And I was just trying to download it, but I currently don't have access to it. But if I do, I'll make sure I circulate it. But it's here. That's the link to it.
We can find that for the follow-up email.
Yeah.
And yeah, in terms of, I do know the answer to looking at the impacts on mental health and health across basic income pilot studies. One of the big challenges with that is studies almost always have a different and incompatible design. So it's really difficult to generalize across different basic income studies. So, I mean, simply they pay people a really different amount of basic income. So a basic income of 50 quid, which I'm not sure there have been pilots of, but yeah, if they were being paid £50 a month for 2 years as the basic income pilot in comparison to £1,000 a month, the impacts would be very different and the comparison incredibly difficult. But Marcia Gibson has done lots of fantastic work on comparing interventions that are relevant or tell us about basic income based on a framework she's developed, and comparing, because health and mental health is almost always an outcome that is assessed throughout the pilots, because that's, you know, one of the driving reasons to bother looking at basic income. So yeah, I mean, the Manitoba basic income experiment, which was, so that's Canada, and Dauphin, that was in the 70s, saw hospitalizations go down by 8.5%, largely due to reductions in accidents, injuries, and mental health diagnoses. The Grey Smoky Mountain study, which is one of the casino studies. So in the US, the profits, it's a dividend of money made by casinos. Yeah, positive effect on child and adolescent mental health outcomes, again, through improved adult mental health. So this thing that you were just talking about there of investing in children, that was allowing the parents to do that themselves, and that was where the mental health improvements for young people came from. The Ontario pilot, which was the one that was cut short in Canada more recently, a few years ago, qualitative evidence from people telling us that they were much less stressed, that they were more, their food security was there, and that they were able to look after their health better. So yeah, health is almost always assessed as part of a basic income pilot, but the ability to compare and sort of generalize what we think a basic income would do to health is really difficult. There is a really exciting project. So Kate Pickett's colleague, Matthew Johnson, who they work very closely on looking at the health case for basic income. And there's a project happening at the moment that is doing some really exciting modelling of what that might be in terms of savings to the healthcare system. I've just realised what a good chat we must be having, because we've gone over by 2 minutes. I'm normally really strict on time. I want to say a massive thank you to Sophie and Jen for fascinating presentations and conversation that I hope will continue. Big supporter of both of their work in the different directions. I think we're all part of the same team trying to push forward things in our different ways, but hopefully it is making as someone said in the chat earlier, small changes make a big difference. Thank you for your time for joining us this evening. If you do have any ideas for what you want to see from Basic Income Conversation in terms of events like this, or who you want us to talk to, do drop me an email. I'd love to hear that. Do make sure that you're on our mailing list and getting our regular updates, and we will be in touch. And we will have more forums like this to connect with soon. But yeah, another massive thank you to Sophie and Jen, and good evening to you all.
Thank you for having me.
Thank you for having me. Thank you, everyone. Bye.
Thank you, everybody.